Hello everyone. So starting with the session of FMGE June 2021. So the target of the session is to make the FMGE student succeed in their exam of the June session. So myself Dr. Monalisa, and before starting the session, just a brief of the platform and introduction of myself. So I have done my MD Anatomy from Armed Force Medical College Pune and have got 7 years of teaching experience for the different examination aspirants. So I would also like to tell you about the Unacademy platform. So here you can have the access to daily live classes. Okay, also structured courses are there for different examination. Okay, live test and quizzes are there, and unlimited SS is there. So what I know that students are quite at times busy with their own medical college sessions, they are on hospital load, internships going on. So meanwhile they can again see the sessions repetitive time, means number of times, and they can use my code Dr. Lisa-YT for 10% discount if they want the subscription or the plus platform of Unacademy. So I would also like to give you the information about the iconic subscription. Yeah, Sri Ram, hello to you. Iconic subscription of Prep Ladder and the Unacademy group, where you can have the opportunity of live classes, along with it the Q banks and the video lectures, live test quizzes and rapid revision courses. And for this also you can use my code Dr. Lisa-YT for 10% discount. So this discount will be given for the plus subscription. Now there is daily T20 test and T21. So those who are appearing for NEET PG 2021 and 2022, there is free live test series going on the Unacademy platform at 9 PM for NEET PG 2022 aspirants and at 8 PM daily for NEET PG 2021 aspirants. So, and I would also like to tell you about the free sessions of Unacademy. So those who want to see the free sessions, they can use the code NAT10. So you can use the code NAT10 and you can avail the opportunity of seeing the free sessions which is going on the Unacademy platform. So of any sessions, any 19 subjects or any sessions, whether it is INICT, whether it is FMGE, whether it is NEET PG, or any session which you want to see, or any subject which you want to see free, you can just use the code NAT10 and can view the session. Okay, so free sessions are there in the month of January. Also I am going to have my free session, so I will you just use the code NAT10 and you can view my free sessions. For meanwhile, I just want to tell you, do join my own Telegram group, that is Monalisa Anatomy. So Monalisa Anatomy is my own Telegram group, and if you join there, I will share the link of all free sessions and you can have the opportunity of seeing all the free sessions, and you will get the PDF of notes also available. Okay, so now starting, yeah, good evening Avi, good evening. So now starting with the series FMGE aspirants. So starting with the MCQ session for the FMGE aspirants. So starting with the first MCQ. So all the best to everyone. The first MCQ is superficial muscle fibers of external oblique muscle arising from middle to lower ribs is interdigitating with which of the following muscle? Whether it is internal oblique, whether it is serratus anterior, whether it is rectus abdominis, whether it is pyramidalis or transversus abdominis. So mark your answer. You can write your answer in the message box. I am seeing your messages. So let me see the right answer. So there are 5 options. So mark the correct answer. Okay. So I am just waiting for the answers, whether it is A, B, C, D or E option. Okay, so I got Sashank is giving B. Okay, so let others also attempt the answer. Okay, Sashank is giving the answer B. Okay. Okay, Hitesh Verma is giving the answer A. Okay, yeah. So any other? Manish is giving answer E. So mixed bundle of answers are coming. Okay, just few more try and then I will come up with the correct explanation. So again, Shushma Reddy is giving answer B. Okay. Sharma, S Sharma is giving the answer B. Okay. What about others? Okay, yeah. So Sriram Chandra Shekharan is giving the answer E. So coming with the right answer is serratus anterior muscle. So those who have given the answer B, they are absolutely right, and the right answer for this MCQ is serratus anterior muscle. Actually, external oblique muscle is interdigitating with two muscle. One is serratus anterior. So one is serratus anterior and the other is latissimus dorsi. Other is latissimus dorsi muscle. Latissimus dorsi muscle. These two muscles are there with which the external oblique muscle fibers are interdigitating. So let me show you a diagram here. So let me just highlight this diagram. Can you see here this muscle which I am showing? Let me just highlight it with some other color so that it becomes quite evident to you. So this is the muscle which you are seeing. This is the external oblique muscle. This is external oblique muscle. Now, the external oblique muscle fibers, as you can see in the diagram, is interdigitating with here other muscles. As you can see here, this muscle which you are shown in the diagram, this muscle is serratus anterior muscle. Serratus anterior muscle, and the serratus anterior muscle, and okay, this is serratus anterior muscle. And also few lower fibers are interdigitating with these muscle. What is this muscle? This is LD. I have written in short form. What is LD? LD means latissimus dorsi muscle. LD means latissimus dorsi muscle. So yes, two muscles are there with which external oblique muscle fibers are interdigitating. Also, you can see here the muscle, external oblique muscle is attached to the iliac crest of the hip bone. What is this? This is the iliac crest. This is the part of the hip bone. So let's in brief see about external oblique muscle details. So please write down about external oblique muscle, because the MCQ is concentrated on the external oblique muscle. So quickly I will tell you about the origin, insertion and interdigitations of external oblique muscle fibers. So it is arising from, it arises from 8 fleshy slips. It is arising from 8 fleshy digitations. Slips or digitations, both are right. Digitations, each from external surface, and inferior border of 5th to 12th rib. That means lower rib. So from 5th to 12th rib, outer surface and inferior border, the external oblique muscle fibers are arising. Okay, so in short you can say lower 8 ribs. In short you can say lower 8 ribs. So this is about the origin part of the external oblique muscle. Now coming to its interdigitation. So the external oblique muscle fibers, as you have seen in the diagram, is interdigitating with two muscles. So the muscle fibers and the superficial muscle fibers are interdigitating on the upper and middle aspect by the serratus anterior muscle, and the lowermost fibers of external oblique muscle is interdigitating with latissimus dorsi muscle. So two muscles are there with which the external oblique muscle fibers are interdigitating. Now coming to its insertion of external oblique muscle. So insertion is the lowermost fibers of which muscle? External oblique muscle will insert into the iliac crest. That is the part superior iliac crest. What is iliac crest? So iliac crest is the superior border of hip bone, and it insert on the iliac crest outer border, or you can say outer lip, on which aspect? Into the anterior half, of it. Okay, so this is point 1 of insertion. Now coming to the middle and the lower fibers. When we talk about middle and the lower fibers of external oblique muscle, it will decussate at linea alba. Now Thereafter, so we have finished with this. Now I would like also to tell you about its nerve supply and also about its actions. Okay, so just I want that you should be well prepared with all the information about external oblique muscle. So external oblique muscle nerve supply is from T7 to 211 nerves and also by the subcostal nerve. So subcostal nerve root value is T12. So this is the nerve supply, and this is the nerve supply. And when we talk about the action, so the action is it causes flexion and contralateral rotation of the torso. Okay, contralateral rotation. So yes, we have done with this. Now can we move to the next MCQ? Can we move to the next MCQ? So the correct answer is serratus anterior. So no doubt about this. In this diagram also we have seen that serratus anterior is the muscle fibers which is interdigitating with external oblique muscle. This is EO, that is external oblique muscle. So yes, we have done with this. Now moving to the next MCQ. Now MCQ number 2. Okay. Greater and lesser splanchnic nerve passes through diaphragm via which of the following options are correct? Whether they are passing via medial arcuate ligament, aortic hiatus, diaphragmatic crux or vena cava foramen. So 4 options are there. Mark your correct answer. So greater and lesser splanchnic nerves is passing through the diaphragm via which of the following structure? So the time starts now. Yeah. So Ambika is giving C as the correct answer. Rohit is giving A as the correct answer. Okay. So yeah, more options, more answers. I am expecting more answers. Sri Ram is giving B. Ravinder Khatri is giving C. Okay. Shushma is giving A. Aditya C. Sashank A. So again, mixed bundles of answers are coming. So I will come up with the correct answer. Sudhakar is giving C as the correct answer. Okay. So mixed bundles of answers are coming. So let me tell you the correct answer. Okay. So the correct answer about this MCQ, okay, C question mark. C is the question mark, as Sarma is telling again C but with a question mark. Okay. So the correct answer. So moving with the correct answer of this MCQ, the correct answer is diaphragmatic crux. So those who have given option C as the correct, they are all right because diaphragmatic crux is the correct answer. Greater and the lesser splanchnic nerves passes through diaphragm where the corresponding diaphragmatic crux. Okay. So as we know, we know the major diaphragmatic opening, and so many times we have seen the structures passing through vena cava opening, we have seen the structures passing through aortic hiatus, we have seen the structures passing through esophageal opening. So I am not going into description of that, that is known to each one of you, I think. Okay, now coming to the diaphragmatic crux and medial arcuate ligament, which structures passes through this structure? So write down the details. Sympathetic trunk, when we talk about sympathetic trunk passes deep to medial arcuate ligament. Okay, so that means medial arcuate ligament is not the correct answer, because in the question the question was not asking about sympathetic trunk, but the question was asking about greater and lesser splanchnic nerve. So sympathetic trunk, so please, these are the minor openings. So I have already taken the session of free live sessions where I have given the details of the diaphragm, major, minor opening and the structures passing. So here 2 minor openings I would like to tell you. One is the structure passing behind medial arcuate ligament. The structures passing is the sympathetic trunk. Now moving to the second. Now there are 2 small apertures. There are 2 small apertures in each crux of the diaphragm. In each crux of diaphragm, and through it what passes? Through it passes greater and that of lesser splanchnic nerves. So this is the correct answer. Option C is the correct answer, and I think few of you have given the correct answer. So option C, that is diaphragmatic crux of corresponding side, is the correct answer, not the medial arcuate ligament. Okay, so can we move to the next MCQ? That is MCQ number 3rd. Okay, So coming to the third MCQ, which of the following veins when dilated produce captive medusa? Okay, so there are 5 options. Which of the following veins mentioned in the options is dilated to produce captive medusa? Whether it is proper hepatic vein, whether it is splenic vein, whether it is cystic, paraumbilical or rector vein. So please mark your answer and let me see how many of you are marking it correct. So yes, so many students, all of you are giving D as the correct answer. So let me expect few more answers and then I will come up with the explanation of this MCQ. Okay, so many of you have given D as the correct answer. Which of the following veins when dilated produce captive medusae? Okay, so let me come with the correct answer to this MCQ. The correct answer to this MCQ is yes, absolutely right. All of you are absolutely right. As Nitesh has come up with the correct answer also, paraumbilical vein is the correct answer. Yes, paraumbilical vein is the correct answer, which is when dilated produce captive medusa. Actually, it is a site of portocaval anastomosis. So I have also taken, can you see here in the diagram? Here can you see these are the dilated veins which you are seeing. These are all dilated veins radiating around the umbilicus, as you can see. These all are dilated veins. Okay. So this is the case of captive medusae, and when does it happens? So please write down paraumbilical vein. Paraumbilical vein, which is a vein of anterior abdominal wall. It's a vein of anterior abdominal wall and it's a component of portal system. It's a component of portal system. Okay, which is anastomosing with, which vein? It is anastomosing with superficial epigastric vein. It is anastomosing with superficial epigastric vein, which is the component of which system? Systemic veins. Systemic veins, and this will lead to dilated veins, that is called as captive medusa, and this is seen in case of portocaval anastomosis. Okay, so the anastomosis occurs between the paraumbilical vein component of portal system and superficial epigastric vein component of systemic system. Okay, so yes, so now moving on to the next MCQ, that is MCQ number 4th. All statements concerning ureters are correct except there are 4 options. All statements about ureter is correct except option A is they are retroperitoneal structures. They cross the pelvic brim anterior to bifurcation of common iliac arteries. They are tubes. They are fibrous tubes connecting kidney to the urinary bladder. Their superior half lies in the abdomen and inferior half lies in the pelvis. So mark the incorrect statement. There are 4 options and you have to mark the incorrect statement regarding ureters. So yeah, so let me so the answers start coming. So Tanya D, Rohit D, okay. So Ambika C, Sudhakar D, okay. Mixed bundles of answers are coming. Sashank D, okay. Sashank is telling D. Again Nitesh is also telling D, okay. Yeah, Nitesh Kumar D, okay. Now yeah, so few more answers and then I can come with the explanation. So which is the wrong statement, my dear students? I am talking about the wrong statements. So most of you have given the answer D. Only one girl has given, Ambika Geeta, she has given the correct answer, and Ambika Geeta, she is absolutely right. The correct answer is C. They are fibrous tube connecting kidney to urinary bladder. My dear friends, students, ureter is not a fibrous tube. Ureter is not a fibrous tube. Ureter is muscular tube. So you have to read the options nicely. Okay, don't make mistakes in hurry. Okay, all of you must be knowing this, but due to hurry you must have not concentrated on the term fibrous tube. So this is not the correct, because ureters are not muscular tube, they are not fibrous tube, they are muscular tubes. All other options are absolutely correct. Yes, ureter is a primarily retroperitoneal structure. They also cross the pelvic brim anterior to bifurcation of common iliac arteries, and they have got two equal halves in the abdomen and pelvis. So certain key points about the ureter. So in this diagram you can see the ureter of both the side, and also you can appreciate that common iliac artery is bifurcating here into external and that of internal iliac arteries. As you can see in the diagram, common iliac artery is bifurcating into external and that of internal iliac artery, and ureter is crossing just anterior to this bifurcation. So this is absolutely correct. So the key points about ureter is that ureter are muscular tube, approximately 25, and sometimes it can also 30 centimeters, 25 to 30 centimeters, which is connecting the kidney to urinary bladder. This is connecting kidney to urinary bladder, and they are retroperitoneal structures. Ureters are retroperitoneal structures. So in the peritoneal class, I have given you the list of structures being retroperitoneal, and the superior half, they are divided into two halves. One is called as the superior half and the other is inferior half, and both the halves of the ureter, that is the superior and the inferior halves, are almost equal length. They are almost of equal length, that is approximately 12 to 13 centimeters or 12 to 14-15 centimeters, and half of it lies in the abdominal region, in the abdomen, and the other lower half lies in the pelvic region. Now when we talk about the pelvic part of the ureter, so when I am talking about the pelvic part of the ureter, the pelvic part of ureter as shown in the diagram also, it begins where ureter is crossing, ureters are crossing the bifurcation of common iliac artery, which can be appreciated by all of you in the diagram. You can see here, this is ureter which is just passing anterior to bifurcation of the common iliac artery into external and that of internal iliac artery. So I think this is appreciated by you. Okay. So now not completely, few fibers are okay, Nitesh, but all together ureter, when you will see the histology of ureter, you will see it is having many muscle fibers in it. When you will see, it is having a lumen and it is surrounded by all over muscle fibers. Okay, Nitesh, so you can just see the ureter, there is transitional epithelium lining, and it is a muscular structures because many muscles are surrounding it, muscle fibers. So that if you will see among the answer, the most incorrect statement will be C. Okay, Nitesh, actually if you go for the answer, the incorrect statement is C, because it is not a completely fibrous structure. If you will go, it's a muscular structure, it is having a thick muscular wall also. Okay, Nitesh. Okay, I thought you are telling it is a fibrous tube. Okay, so I just thought that you are telling that it is fibrous, not muscular, so I was giving this explanation. Okay, means you are convinced with the answer, Nitesh? Yeah, so can we move to the next MCQ? Next MCQ for today's session? Yes. Now coming to the option MCQ number 5th, which of the following nerve do not innervate scrotum? Okay, which of the following nerves are not innervating scrotum, is not giving innervation to scrotum? Is it ilioinguinal, genitofemoral, pudendal, posterior femoral, cutaneous, obturator? Which is the best answer? So go for the best option. So So Nitesh is telling E. Let's other students also. Okay, I got Pankaj as B, genitofemoral. Okay, so yeah, E. Sriram is telling E. Okay, Patel is telling E. Okay, Rohit E, Tanya E, okay, Sashank E, Prem E, Pankaj E. Okay, most of the students are telling E. Only one answer is B. So coming to the correct answer to this MCQ, D. Pankaj Rai is telling D, posterior femoral cutaneous nerve. So yes, so Manisha is telling C. Okay, SN. Dr. Manjunathan, SN is telling C. Ambika, no clear idea, ma'am. Okay, so that also, it's okay, nothing to worry. I will give you the detailed explanation of innervation of the scrotum. Actually, the correct answer is E. Obturator nerve is not innervating scrotum. So the correct answer, most of you have given, approximately 80% of 70% of you have given the correct answer, that is obturator nerve, and obturator nerve is not giving nerve supply to the scrotum. Coming to the explanation of this, so please write down. Actually, if we tell about the nerve supply of the scrotum, nerve supply of scrotum. So nerve supply of the scrotum, anterior part, anterior aspect of scrotum is supplied by, when we talk about the anterior aspect nerve supply of the scrotum, it is supplied by, okay, it is supplied by anterior scrotal nerves. It is supplied by anterior scrotal nerves, and these anterior scrotal nerves are derived from which nerve? So they are derived from ilioinguinal nerve. They are derived from ilioinguinal nerves and that of genital branch of genitofemoral nerves. Genitofemoral nerves. So they are derived from ilioinguinal nerves and genital branch of genitofemoral nerve. So this is about the nerve supply of the scrotum on the anterior aspect. Now moving on to the nerve supply of the scrotum on the posterior aspect. So nerve supply of the scrotum on posterior aspect. Write down. Nerve supply of scrotum, and here we are talking about the posterior aspect nerve supply. Posterior aspect. So when I talk about the posterior aspect nerve supply, the nerve supply is by superficial perineal nerve, superficial perineal nerve, also by the perineal branch of, posterior femoral cutaneous nerve, posterior femoral cutaneous nerves. So all these options which I have written here is already given in the option. So only the correct answer will be obturator nerve. So what we can appreciate here, if again I come to the option here, ilioinguinal nerve, that is option A, it is providing innervation to the scrotum anterior aspect. Genitofemoral nerve is also providing innervation to the anterior aspect of the scrotum. Pudendal nerve, actually pudendal nerve and its posterior femoral cutaneous nerve, all are providing innervation, but obturator nerve will not be the correct answer because it's absolutely not. Posterior scrotal nerves are the nerves, they are the nerves. So the nerves which is arising, these are the nerves which is giving the posterior aspect of the scrotum as the nerve supply. Posterior scrotal, all these are the branches from the perineal nerves. Okay, so yes, Ambika, so the correct answer here, obturator nerve in no case is giving any kind of innervation to the scrotum. So the correct answer to this MCQ is obturator nerve. So again I will come up with this series of MCQ which will be designed absolutely for the FMGE students, and also in between I will come with NEET PG aspirants MCQ session. So before ending this session, I would like to show you this diagram also. Here what you can see, the nerve supply is from ilioinguinal nerve, genital branch of genitofemoral nerve, posterior scrotal branch of perineal, and also perineal branches of the posterior cutaneous nerve of the thigh. So see here, what I told you, posterior scrotal nerves are the branch from perineal nerve. So Ambika, is it okay? Posterior scrotal nerves branch from the perineal nerves. These are the branches of perineal which is giving innervation to the posterior aspect of the scrotum. So I think, is it clear to you, Ambika? So again, I will come up with my next sessions of YouTube where I will explain few more MCQs related to the topic of anatomy. So before ending the session, I would like to tell you, you can avail the opportunity to see my Unacademy free sessions, and also any of the session which you want to see, you have to just use the code ANAT10. So just use the code ANAT10 to unlock. Firstly, you have to, for the students who are seeing the live session for the first time, they have to download the Unacademy app and they have to search for NEET PG, and then they have to go for the free sessions, whichever session they want to view or see and become a part of it, live quizzes and all. They have to just use the code ANAT10. Free live session. So I am coming in the month of January 2021 with free live sessions. So I will just update about the routine and the schedule of my free live sessions on my Telegram group, that is Monalisa Anatomy. So also on the Monalisa Anatomy Telegram group and also the Telegram group of the Unacademy. So you can just, those who are not the part of Monalisa Anatomy group, Telegram group, they can be a part of it. There I will send the link of all my free sessions. Just use the code ANAT10 for unlocking the free sessions. Yeah, thank you so much at Sarman, thank you so much Ambika, thank you so much Pankaj. Okay, so again I would like to tell that those who want to become the part of the Target Next 2022, so this session has already been started in December. So I am going to take in the month of April approximately 70, so total of 72 hours of anatomy for the aspirants of the next 2022. So these all sessions are evening sessions, that is from 3 to 10 p.m. every day except the Sundays, and you can be a part of this session. The batch highlights are: the concepts will be cleared of all 19 subject, discussions of highly probable questions, and also the pattern of coverage of all the questions with doubt clearing sessions. So these are the key factors of the success. So you can be a part of this session. These are the educators who are taking all the subjects in this coming next 2022. So this session is ending in the May. So before ending the session, those who want to take the subscription of Unacademy platform, they can use the code Dr. Lisa-YT for 10% discount. And this is the Telegram group of Unacademy, that is Unacademy NEET PG, where the free sessions of all the 19 subject is there. So you can be a part of that session. You have to just use the code ANAT10 for unlocking the session. So you have to use the code ANAT10 for unlocking the session. So many times I have told you this, and this is for the new students who are just for the first time downloading the Unacademy app. So just find NEET PG Goal and you can be a part of doubt clearing and live sessions. So again, those who want to become the part of Telegram group, this is the link, Monalisa Anatomy. This is the Facebook group link, that is Monalisa Anatomy, Dr. Monalisa Anatomy. You can view my YouTube sessions and free live sessions. You can use the code, and this is the link of Telegram group of Unacademy. All the best, keep studying. Thank you so much. Again, I will come up with new session of FMGE pattern MCQs, also NEET PG questions. All the best and keep studying. Thank you so much. Thank you.
मेल खोलो।
हाँ, इसको बंद कर देना है। All stream recording will be so done. Are you sure you wish to exit? Yes.